would just like to talk a little bit about postnatal depression, which is something that can quite often go undiagnosed. So if you have had any depression in your pregnancy or a history of depression, then it's really important that you talk to your health visitor, your midwife, your GP while you're pregnant, and let them know that that has been in your past, because antenatal depression can be quite strongly linked to postnatal depression. Sometimes people just get postnatal depression out of the blue. Sometimes it just creeps up on them. So I think I did have postnatal depression with my first child, but I didn't realise it for a long time. I really loved him. So I think one of the reasons why I didn't recognise that I actually was postnatally depressed was because I was, very much in love with my baby. And one of the symptoms that you quite often read about is detachment from your child. So sometimes people do feel detached from their child. And this is obviously a symptom of postnatal depression, but I would say sometimes they don't. So it was only really because I was studying Chinese medicine that I realised about 6 months, when I returned back to my studies after 6 months after he was born, I went back to university and I realised that I had massive blood deficiency, which is quite easily treated. I had been anemic throughout that pregnancy. I'd had a lot of blood loss following his delivery, and basically then he never really slept, which was also linked in Chinese medicine terms to my anemia during my pregnancy. And all of those things contributed to me just feeling really low, struggling to get out in the daytime. But I always loved him and cared for him, so I think that it was very masked for me. But if you are feeling in that way, then I think it's really important that you talk to someone, to anyone, to your partner, to your friends, to your mum, to your midwife, to your GP, and that you get help. So there's so much that people can do now. They can give you talking therapies, they can give you counselling, they can just give you more support. Sometimes they might offer you medication which you may or may not want to take, but acupuncture certainly works for me. So making some changes to my diet to incorporate more blood nourishing foods, I was taking an iron supplement and all of that, and then and luckily it didn't happen with my subsequent pregnancies, but I did encapsulate my placenta, which is actually great for preventing postnatal depression. So I think that really helped. But you don't have to suffer. If you are feeling low and blue and feeling that you're struggling to cope, then acupuncture can really support you. But please do also tell a medical professional and other people in your life so that you can get some help.